Welcome to CareTalk, America's home for incisive debate about healthcare, business, and politics. And today we have one of our favorite return visitors, is Dr. Zeke Emanuel, a longtime friend of the show, longtime critic and proponent of the right kinds of healthcare policy. And now he's drifted into personal wellness. Zeke, welcome back to the show.
It's great to be here with you, John. Thank you for having me.
Zeke, maybe we'll start with policy, and then if you're okay with it, tease a little bit about the wonderful book on wellness that you've got coming out in a few months. So, how are
Great.
you feeling in general about the administration's healthcare policy?
Schizophrenic, manic depressive, I think is probably the good way to put it. I think there are lots of things which are depressing. You know, the vaccine policy, the acetaminophen effort, the whole shenanigans about autism.
Let's stay on acetaminophen. On acetaminophen, they're speaking of schizophrenia. What do you think the policy is? What did they say, and what are they doing? And does it make any sense?
Well, it doesn't make any sense. That's for sure. There's no good evidence that they have introduced. I think the first thing is to understand acetaminophen is an important non-steroidal uh, uh, pain reliever, and been used a lot. And especially for young kids, you need it. But also, if you can't take non-steroidals like aspirin or Advil, it's very important item for pain relief. That's the first thing. The second thing is, and I think this is really important, this drug has been around for 130 years. And with the flowering of chemistry in the late 19th, early 20th century in Germany and Switzerland and places like that, this was discovered along with aspirin, and has been used for a long time. Now, if this had a really big impact on autism, we would have seen it before. It's not like it just started. The second point, I think, that is really important is there are lots of countries with very high usage, higher usage in the United States of acetaminophen, and we're not seeing differential, like a big explosion of autism there that doesn't exist in other places that have less use of acetaminophen. Could there be some impact? Yes, but almost all the researchers will tell you this is very complicated in terms of what's causing it. Multimodal for sure. You know, some genetic, some environmental, and the signal about acetaminophen. There are some, some suggestion in some studies, but you're not seeing this. The explosion we've had over the last 35 years is not acetaminophen suddenly exploding on the market, brand new drug that you see it like, think about thalidomide causing.
To your point about thalidomide, I mean, my impression of the study that they originally built it around, the Johns Hopkins study, is that it was actually more of a correlation than
Yes.
causation, that there actually is, I mean, correct me if I'm wrong, but I don't think there's any causative case that has been documented, scientifically researched and validated that acetaminophen and autism are tied at all. It's a correlation that
Yes,
in some of the data.
exactly. Yes, exactly. In some of the data. And I think both of those points are really important. It's some of the data and it's a correlation, not a causation. Some of the big studies that have been done, the people unfortunately have financial interest. And who knows about Kennedy and his financial shenanigans? The cynic and skeptic will say, look, he's just setting up to make more lawsuits when he gets out of the administration. You've heard this line. I don't know, but I think this is it's confusing things. It's doing a disservice to the public who's not like you and I, sort of much closer to the research. And I think that confusion, it's with acetaminophen, it's also with vaccines. That's not serving the public.
Let's stay on acetaminophen, because I think this was my most fascinating part of it, Zeke. I don't know whether you got this letter, but Dr. Marty Makary, the current commissioner of the FDA, sent out a letter to many doctors, many pediatricians,
Yeah.
many sort of family doctors, saying in an abundance of clarity, and I believe the letter on FDA stationery says that the acetaminophen is the safest analgesic pain reliever on the market.
Oh, there are definitely downsides to aspirin, especially again, used in the wrong context. And this it has one big side effect that we know and well documented, which is you take a lot of it, you empty the whole bottle in your mouth, you get liver failure, and you can kill yourself, no doubt about it. But save for that intentional problem, or a young kid getting into the medicine cabinet, it is the safest. And I just think the whole thing is kind of crazy. And again, it's confusing. And as I've gotten older, one of the things that you appreciate is, we spend a lot of time focusing on health. That's what our business, right? The public is like, it's a passing thing. And so, big headlines like acetaminophen causes autism, and they're not going to delve deep into it. And it's just confusing and creates more problems for people than it clarifies. And that's not the kind of thing the Secretary of Health and Human Services ought to be doing.
So
And
let's dig into vaccines a little bit. Is there any legitimate argument against the conventional accepted vaccine regimen that that pediatricians and again family doctors have been applying to improve the health of children?
The short answer is no. We have saved millions of lives, hundreds of millions of lives actually, with vaccines. And uh, all of the excuses, the thimerosal and the mercury, the aluminum, the multiple vaccines at one time, we give so many, what's it doing? All of that is, again, it's just confusing, not backed up by any data. The thimerosal, which is a preservative put in so you could put multiple doses in one vial and reduce costs that way, largely out of the vaccine pipeline for in America already. And again, no evidence, big studies in places like Sweden, where you can really follow every single birth in a way that we can't in the United States. No evidence that any of that's true. Same thing with the aluminum in there in the vaccines, and no evidence that multiple vaccines given together in one shot is a problem. And as a matter of fact, one of the problems of, well, we're going to give individual vaccines is, oh, so now you're going to give 3 shots at one sitting, or you're going to have people come back and forth to the doctor. Well, we know what happens if you say, oh, we're going to give you a shot this week, a shot next week, and a shot in the
They
third
don't
week.
come back.
Exactly. It ain't going to happen. And so you're going to forget. You're not going to get one shot in. I don't know what it is, mumps or rubella or, diphtheria. That is a problem. And it's much worse problem.
And so and so
What, so that,
what happens if a significant minority of people just opt out, which is happening in parts of
we're,
Utah, parts
yeah,
of Texas, parts of Louisiana. I mean, a lot of parts of the
we're seeing
country.
it. We're seeing it everywhere. Lots of measles outbreaks, which leads to kids' hospitalizations, which leads to some kids dying. All preventable. All preventable by vaccines. And the issue with measles is easily communicated between children. And if you don't have 95, 97% vaccination rates, it will spread. And we have seen outbreaks where in communities that haven't gotten vaccinated, and that's what's happened in Texas. It's what's now happening in Utah, and it's happening in other pockets around the country. A few years ago, it happened in upstate New York among the Orthodox Jewish population. It's a terrible problem. There's no reason to have this, and this gets back to, I think, what is a very interesting phenomenon. All the parents who are alive today and making choices about their kids, grew up after we had vaccines. And so they have no experience of what the world's like without vaccines, which their parents had in the 50s and 60s, where, if you look at the old photos of the 50s, where kids are lined up at school, their parents couldn't get them in the line fast enough to get the polio vaccine because it was such a threat. And the same thing with measles, and the same thing with chickenpox, just to get rid of that. And now that we live without those threats, we're like, well, why do we need the vaccine? There's no big problem with these things. And we forget, well, no big problem until lots of people don't have the vaccines and these diseases spread. And that, I think, it's like we're actually the victim of our own success. We succeeded in getting rid of these outbreaks, so people don't think they're that important and don't see that the reason we don't have these threats to our lives from these infectious diseases is, okay, the triumph of vaccination. And that therefore you have to keep getting vaccines. And that's the real worry I have.
So those are the facts. They're well known. These are public health truths, validated not just in our country, but in countries where the Gates Foundation, the WHO, the countries themselves have gone out and done the pre and the post on the vaccinations. But we live in sort of a tentative post-truth world of misinformation. How do we combat this sort of the conventional commerce of misinformation?
This is a big issue. Actually, we have a paper coming out in the Lancet specifically about this, because I've spent a number of months now really thinking hard about this. Um, uh, the 10,000 foot summary is, look, we've got science, and the problem is that the public is not hearing the science because we're not communicating it in the right way. There's lots of reasons for that. Two main things I think that need to change is, the first is the algorithms, which keep people in a bubble. That, once you look up, what are the dangers of measles, and then keep piling on the dangers of measles shots, and get you into a bubble of skeptics and anti-vaxxers, we got to change those algorithms. There's no First Amendment issue there. We have to change them so that you get a diversity of views. This is important not just for health and vaccinations and misinformation there. It's important for politics and important for many, many issues. I think that should rise to the top of the legislative agenda when they finally get the government reopened. The second and important thing is, we as health people need to change our communication mode. We have not adapted to the modern social media world, where TikTok, Instagram, you've got these 60 to 90-second windows where you have to maintain scientific accuracy, but you have to engage people in the way they're now listening to you. And, look, I'm as bad as the next guy. I like to write op-eds that are 800 to 1,000 words. When I do my TikTok, which I've just started doing because of its importance in communicating, I'm at 2 minutes and 30 seconds. I'm told it's twice as long as anyone's attention span. But I think we have to change how we're communicating, and I think we're not doing a good job of that. We being the large public health and healthcare community. And so I think those are two of the many areas we have to start with. We also have to be frank. One of the things I think we have to be pretty clear about is, I'm not selling you anything. I'm not talking to you because I'm going to make money on this. I got a supplement on the side. I got whatever. And I think that's an important validation to people, that this is not about my enriching myself. This is about my communicating the understanding I have. And I think there's a whole series of things we really need to begin doing as a community, and some of which we can do ourselves by adopting different ways of communicating, some of which is going to require us to work with Congress and legislation to get the algorithms altered, because we're not going to beat this if we have to fight against those algorithms that keep people in bubbles.
Well, no, it's this reinforcing bubble, and also rage and strange appears to be the things that grab headlines. Zeke, maybe we'll pivot a little bit and talk about, you were one of my nominees to be the head of CMS in the Biden administration. You didn't get that seat. I think you would have been great. Uh, as you think about what the Center for Medicare and Medicaid Science services are doing, the group that actually runs the government policy for the poor and the elderly, uh, how are you feeling about it? Because they've got a lot of, I think, some pretty innovative things going on. What's your what grade would you give CMS and why?
I would probably give it a B plus or A minus. I actually think they're doing pretty good stuff. I think the main, they're trying to improve the healthcare system. They're trying to change. I think some of their efforts are being criticized. Like, they're using some prior authorization techniques, and people have been criticizing them. Although, if you look at the things they're asking for prior authorization, like skin patches, probably really good. They're asking for prior authorization. They're pretty expensive. The evidence supporting them
Just
is,
to be specific, it's an area of a fair amount of Medicaid fraud and
uh,
abuse. And just to be,
absolutely.
the prior authorizations that they're looking for are on areas of pretty well documented. There's obviously some cases where people really need it, but the utilization is of those patches for in Medicaid is wildly disproportionate to the actual number of cases, which is a fair indication. So I think
Yes.
that's sort of interesting. What else is
Look,
driving the great inflation you're giving CMS?
I'm anti-grade inflation, as everyone knows. So I think that they're trying some innovative strategies, and the most important thing, and I think you hear this actually a lot about this administration. On the plus side, people will say they're open to hearing things, which and you can get more easy access than going through 27 people before you can talk to, like, the head of the Medicare division or the head of CMMI. And, I've been talking to them about risk adjustment and trying to make it more
How the
rational.
Medicare and risk adjustments is basically the driver of a lot of the profitability of the Medicare Advantage plans
It's
that
basic.
many
Look,
people have suggested is a flawed system.
well, everyone knows it's flawed. The question is how flawed, and more importantly, the question is, do you have a replacement? And we've developed a replacement for them that uses exactly the same information they have and is 3 times more accurate in predicting expenses. Similarly, we're talking to them about hypertension and GLP-1s and initiatives around all of that, which I think are they're trying to be creative, they're trying to be innovative, and I think they're very open to ideas. Now, between being open to ideas and implementing things that both improve quality and reduce costs.
But I don't think this administration in general is seen as being open to multiple approaches, regardless of the political background. I think what you're saying is this CMS is, and Mehmet Oz and his team are really trying to get the best option within the context of their policy priorities and not worried about the source, which is great.
Yes, I wrote before they took office. One of the positive things about them is they are not, they are a group not beholden to interest groups. They don't really care what this interest group says or that interest group says. And I think that's actually, in the case of healthcare, a very good thing. Now, whether they can take that attitude and the openness, which I think, again, CMS may be out of step with some of the other parts of the administration, including HHS, on this. Whether they can take that to real policy changes that are going to actually reduce cost, I think is a one of the big questions. But I would say, we're out what they're not 9 months into the game. I think a lot more activity than we had under the Biden team, and a lot more innovative attempts.
Well, we're gonna bring you back to talk about your book, but I'd like to tease it with one question. The title of your upcoming book is "Eat Your Ice Cream." Zeke Emanuel, proponent of a healthy, leaner, meaner, stronger America. Are you really suggesting that eating your ice cream is healthy?
Yes, I'm actually a big proponent of dairy. I like to note that the Dutch are the tallest people in the world, and they're one of the highest dairy consumers also in the world. There are lots of people say, well, there's saturated fat in ice cream and there's sugar, and all of that's right. Although the saturated fat is in a separate membrane and may be processed in a very different way than saturated fat, for example, in red meat. But also, I'm not of this view. One of the things of this book is wellness is not about self-denial. It's not about don't do all this kind of stuff. Don't be obsessed. And part of it is, enjoying life and moderation. And yes, having ice cream and good ice cream in moderation is something that you should do. And there's some evidence that actually ice cream protects you against type 2 diabetes and other things that typically it would be associated with. And so I am definitely of the view that you've got to live, and there's the body is made such that you shouldn't go to extremes. And wellness is not.
Don't run past yes here, Zeke. Our listening audience and viewing audience wants to just hear a yes. So
yes,
Zeke,
look, I think I say in the book. Correct me if I'm wrong, John, but I do think I say in the book, ice cream it should not be a guilty pleasure.
You do.
It's not a guilty pleasure anymore. It's a genuine pleasure.
And so you heard it here first, folks. Zeke, thank you so much. I just think we have to wrap it there, and we'll bring you back to for the book, which is an incredible, entertaining, and enlightening read on wellness. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service. And Zeke, thank you so much for joining again.
It's always a pleasure, John. This is great to be with you.